Good morning. Good morning. Good morning. Good morning. I am on my computer right now. I'm about to have a meeting with this doctor. She's a dermatologist, and I think she's also like a trichologist. So she specializes in like hair treatments and just hair in general, hair loss, all that. So I'm having a consult with her just to speak to her about my hair loss and everything that I've been going through and stuff like that. I want to talk to her about possibly doing PRP or PRF, which is something that I know that this clinic offers, and it is a clinic that's pretty diverse, and I'll be speaking to a doctor of color, and I just feel more comfortable speaking to someone that looks like me. So this is simply like just a consult to ask some questions and kind of get familiar with them and their services. And I'm going to see what they offer and if they may be a good fit for me. I saw that they were doing like PRF. I think I found them across like TikTok. So they look like a pretty cool clinic, nice reviews. They seem pretty reputable, very clean and all that. So I'm going to speak with the doctor. And yeah, just get a better feel of maybe what she could help me out with. I've noticed like this area right here, the hair is a lot shorter. You can kind of see, it's kind of dark, but the area is like a lot shorter here, like in my hair loss areas, like where my hair was already thinner. Yeah, my hair was like already thinner in those areas, and it's still like, it's growing, but it's a lot shorter. And I'm kind of worried about it, but I feel like maybe after the transplant, those areas maybe just probably didn't respond as well. I'm not too sure because it has been 10 months. It hasn't even been a year yet, so there's still time, I guess. But I just want to consult with someone, ask them a few questions, like see if they recommend anything, things of that nature, or if there's something they could help me with, or just like what are my options, you know, because it's very noticeable to me. I feel like other people can notice it, but it may not be as noticeable to them. You know, you always kind of like critique yourself a little bit more than the next person. So my appointment's about to start, so I'm gonna log in, get on the video call with her, and see what they have to say. So yeah. So basically, I have hair loss that runs in my family, specifically on my dad's side, and I noticed. I would say I'm 26 right now, and I would say I noticed around like 24. At that year, I was trying to grow my hair out, and it was very noticeably like a lot shorter down the middle and then into my crown. I've never had the best hairline, like it's always kind of receded, but the sides like were thinning stronger and stronger, but it was really the middle, like the rest of my hair would grow and the middle would be a lot shorter. So that's when I noticed it. I cut it off. Last year I actually got a hair transplant, so that's helped me out a lot, like especially with my hairline. I'm very happy with it now, but I do have, and it's been 10 months right now. It'll be 11 towards like later on in July. It'll be 11 in like 4 days actually. But so I'm happy with my results, but I feel like they could be better. Like if you saw me in person and you felt my hair, the areas where I had thinning at, they're a lot less dense. And I don't expect it to be as thick as my natural hair, but I would like it to be thicker than it is. And it's also shorter. So I've been like, my hair is, like I said, it's been like 10 months. If you were to try to do like 2-strand twist or something like that, for example, you would have, I believe, a difficult time in the center of my head because it's shorter and the hair is thinner. So it's growing, but like at a slower pace. And I am taking minoxidil, finasteride with biotin, but it's all in one pill. It's like a daily pill that I take. I told my primary care physician, and she's okay with it. She looked at the dosage and everything. She's fine with it. I just wanted to kind of consult a doctor that maybe like looked like me, that may have like different advice or just know like my hair type and stuff like that better. I saw you guys offered PRP. I've never done it, but I thought about it, and I kind of just wanted to know maybe what you might recommend or think would be a good like next step.
Option. Okay, sounds good actually. So how long, I wanted to know, how long have you been on the compounded medication?
That I've been on for 3 months.
Okay.
So I got the transplant, like I said, like it was 10 months ago. It was last August I had got it.
Hmm.
And they do recommend that you may need PRP, minoxidil, finasteride, all of those things. But
Hmm.
I didn't even, I started, so basically the first 6 months, I didn't do any medical therapy at all. I just
Gotcha.
wanted to kind of let it grow and see how it did and like what it would do. And I
Hmm.
know everybody's hair type is different. At 6 months, I felt like my hair was growing, but my results were like way off, like not improving like I felt like they should. So I started using only minoxidil. And then
Okay.
after I started using minoxidil, I then threw in like, I was using topical minoxidil and
Right.
it was working and it like worked tremendously and
Hmm.
I saw a huge difference in the growth. Like I
Hmm.
said, the density is not where I wanted, but the growth I saw a huge difference. And then since I'm trying to grow my hair and it needs to be moisturized and things of that nature, I didn't feel that
Hmm.
topical minoxidil would work best because your scalp needs to be dry. So I stopped using topical and then I just went to the pill where it had that and finasteride. Because I wanted to try
Gotcha.
finasteride, but I wanted to try minoxidil first. So I figured I
Hmm.
would do the pill where it has all three, and then that way I could take
Sure.
it once daily and not have to put it in my scalp twice a day and just make it more
For
difficult.
sure.
So I would
Okay.
say
Gotcha.
like a little like 3 months ish. I've been on the medical therapy.
Okay, good to know. Yeah, I would say that would take about 4 to 6 to kind of see results. You don't have any side effects from the medication. Those are kind of the biggest things, of course.
No, I don't. Like the ones that I've looked up, I don't have
Right.
any side effects. The only thing that I would say kind of worried me at first was like when I first started taking the pill, my heartbeat was like
Hmm.
faster and I just noticed it more. Like, I mean, I noticed my heart
Hmm.
beating, but it was very noticeable at the beginning and I was just kind of
Hmm.
like worried, but she said that would be normal and stuff. So
Exactly.
then she also recommended that I take the pill in half. So
Hmm.
I did that for a little while, and then like now it's like subsided. Like I don't really feel like that
Good.
anymore. Like I feel like I may have a moment like here and there randomly where I
Sure.
maybe feel my heartbeat like more intense, but
Faster.
yeah, but overall no.
Good.
Yeah, so
Good, good. So yeah, that's really good to know. The minoxidil, I think you're at, and the finasteride, that between the two of those are at a good dose, pretty low. Like you said, you just started off with half. The thing about the topical minoxidil is that you have to keep using it to see results. So basically, it literally changes the structure of your hair follicle. And so, for example, like let's just metaphorically speaking, say that your natural hair follicle structure is a circle, and basically the minoxidil will turn that into a square to be able to deliver more blood flow to it. But when you stop using it, it returns to the circle. So you basically will return to baseline. So I tell people don't hop on that train unless you want to stay on it, basically.
yeah,
And so it's a commitment. And sometimes in people who are 26, I might not start it because they're like I might fall off. So I'm like there might be some other options for you. So with our hair health program, we offer a drug-free option that you would be able to start and stop without the fallout of being able to go back to baseline if you decided to discontinue it. And it kind of works by addressing underlying issues such as metabolism, nutrition, in a more holistic point of view. But again, that is drug-free option.
yeah,
So I know you're already taking some medications, but if you're ever interested, I think that would be a good benefit to also maintain your hair transplant results in conjunction with the PRP. But with the PRP, what we do, of course, is draw your blood and then those growth factors after we spin it down and also inject directly into your scalp. Most patients are needing around 3 sessions, I would say. But even after the first session, they're getting results. And based on your history, especially on your dad's side, you're saying that a lot of, whether it be men or women, actually are going through hair loss. That indicates that you're basically having something called androgenetic alopecia, which is the type of hair loss you're experiencing. And so PRP, the articles that are out there in regards to PRP actually specifically are targeting that type of hair loss. That's one benefit for you for sure. I agree. Sometimes if you have a chronic form of hair loss, you got the hair transplant, which kind of gave you the kickstart, but then you're still, because the mechanisms are still in place that cause the hair loss in the first place, essentially, you will need to do something to kind of maintain your results. I think the prescription option is one way of attacking it. Maybe getting in a drug-free option would be another perspective. And then the injections directly to the affected area would be kind of that third kind of holistic approach more so.
Okay, so you wouldn't necessarily like have any patients where you do PRP and a holistic option together. It's kind of like
Yes, absolutely, absolutely. It depends on the person, and it depends on what type of hair loss I'm treating.
Okay.
And so everybody is going to be a little bit different about what I recommend. Depending on their type of hair loss. But because of your type of hair loss that you're experiencing, you would be a candidate for all three options, really. So now you're already doing the prescription option, which is great, and then the drug-free option is Nutrafol. And it's going to be 4 capsules a day.
Okay.
So Nutrafol is a type of nutraceutical, and so we don't actually recommend, like, there's no research to support large doses of biotin that's going to give you increased hair growth, and so nutraceuticals would be a better way of doing it, and so that's kind of the holistic approach that we're referring to.
Okay, because I'm glad I'm speaking to you because I wanted to explore a more holistic way of treating it because I know that it's more than just like medication, that it could relate to your diet and hereditary things and genes and all that. So I kind of wanted to, even though I feel like the hair transplant helped me a lot, I still wanted to like try to attack the root cause a lot better because I know that it's more than just, you know, my hair is like
one problem.
Yeah, so I would be interested in exploring that. I feel like I think one of my questions with that is if I were to do like a holistic approach and or PRP, since that's not necessarily like a medical way of treating the problem, would I stop taking what I'm on, and what could I
wouldn't.
Oh no, so still
I wouldn't.
take it.
I would.
Oh, okay.
With hair loss, I want to throw everything but the kitchen sink in, to be quite frank.
Okay.
I like the option of the drug-free option because, again, it's addressing things like stress and metabolism and nutrition, some things in which the minoxidil orally and the finasteride orally are not doing. They're more so only targeting the hormonal component of that, and so that's why you need the drug on board. But as far as the nutrition and the metabolism and even stress, and lifestyle is not addressing at all, essentially. And so that's why I think, you have something attacking your hormones. You have something kind of working on that. But some of the things are going to be, supplementations, probiotics, prebiotics, ashwagandha, and more holistic herbs that you would be utilizing within the Nutrafol to be able to also address those underlying issues and not just one part of it, like you were mentioning.
So is the holistic route strictly Nutrafol? Or is there anything else that...
Yeah, and also the PRP. So the PRP, because there's no medication, you might be familiar. I don't know if you're seeing derm, but or just the PCP, but they may have even offered you steroid injections in the past, which there are side effects associated with steroid injections. And so these are both drug-free options that you're able to. So when we say a holistic approach, I think more so we're trying to target at things not only that are underlying, but then also that they don't contain any medications in them.
Right.
So there's no fallout, there's no adverse side effects associated with these therapies because I'm not changing the structure of who you are and what your hair is necessarily doing, whereas with the medications I am.
Okay. So if I didn't start the medications that I'm on and I was still experiencing the same issues, like, do you ever have people that you still don't like have them try medications that may try other things, if that makes sense? Like,
what do you mean?
Like if I never started the finasteride and the minoxidil, but I was having hair loss and I wanted to address it, would you ever recommend that I just do the Nutrafol and the PRP, like, and not medication?
It depends on, actually, it depends on, to me, I try to do the least amount of interventions to get the job done, so to speak. And so usually I would actually have started with the Nutrafol actually probably first before I intervene on the medical side to see if, because minoxidil is changing the structure of the hair follicle, similar to like the topical deal is, I tell people you also need to continue that medication, because if you stop taking the oral medication, the same effect would occur. Where again, as the Nutrafol, they can get off and on without completely going back to baseline. And so I would say I would have gone actually in the opposite way, because once you're on that, you're on that.
Yeah.
Whereas these, they have the potential to play around a little bit with, but it just depends on the person, and then also how far I guess advanced the hair loss really is too.
Yeah.
Because I want to be able to, stop the hair loss in its tracks as well. So if I have a person who's a little bit more progressed, I might suggest that they start both the medication and the Nutrafol at the same time.
Right. Because I would have, ideally, like, I would have, I heard of Nutrafol and I kind of looked it up, but I still didn't understand.
Well, so
yeah, like
yeah.
I kind of thought, like, you could have told me that Nutrafol and like minoxidil and finasteride had the same ingredients or something, and they like are doing the same thing, but maybe are just two different like brands or ways of like taking it. So I heard of Nutrafol and I kind of read about it, but I didn't specifically know like, oh, that's gonna like do something. But I kind of wanted, that's kind of why I waited so long to even start the minoxidil and finasteride, because I was like, I've read and I've like researched about it that once you're on it, and that's why I waited so long, because I was like, I want to see if maybe something else would work, because I think honestly still even now, like, I would rather not be taking the medication if I could, and just like whatever natural remedies would work for me. So I'm willing to like explore that, but is it just that if I were to get off of it and do Nutrafol or like whatever other things, I'd experience hair loss because I was using it for a while and everything like that. Like, I guess what I'm trying to ask is like, is there...
Can you get off of the compounded medication?
Yeah, and then also like still experience hair growth by starting Nutrafol or something else, or PRP, like...
You're saying, could I offset it if I still was doing something else? Well, the thing is, I think I think it would be a replacement situation. If you decided, okay, I want to, it would be either or on the pill situation. So if I wanted to do the compounded one, I would stick with that one and not do Nutrafol. Or on the opposite spectrum, I would stick with Nutrafol and not do the compounded one, because the PRP, regardless of the fact, is going to be a temporary situation anyway. You know what I mean? So you're going to be either doing 3-section or 6 sections, but eventually that's going to stop. Now you could do one, once a year, twice a year for maintenance to kind of hold your results over as well, if you still wanted to be able to prolong that progress. But I think on the oral route, I think you would have to decide which you're going to be on the train, but it's about which one you want to be on.
Yeah, because I don't know, I would feel more comfortable not taking
a more holistic, something like drug, but it's not a drug.
Yeah, I just would feel more comfortable, especially like long term, because I've just read things that kind of like disturb me. And then also I think just if it helps you at all, my dad, he passed away last year from an aneurysm, brain aneurysm. Okay. So I know that has like to do with blood pressure and things like that. I told my medical, like my primary care physician as well. So I don't know, like, it's just like that whole thing and medications and stuff like that. I just want to be like careful.
You just want to be cautious.
That's like why I'm like even consulting doctors, because these are things that I don't know, and I just like want like a better.
You're just trying to get all your information.
Yeah. So like right now, I have this weird thing, like my hair. Like I said, I'm fine with my hairline. My hairline is really thick, but there's like sides. I know it's hard to see on camera, but there's like sides here where it's like not a lot of hair. It's not really dense at all, and then it's also like here in the front. So I have a picture that might give you like a better kind of. So like
kinda
that
going down
area.
The crown.
Like I mean the crown is better. It's a lot better than what it was, but it's like right here in the front. Yeah. So like when you look at me like straight on, it's harder to tell because like my hairline's so thick. But like if I took my head down, or if I try to do something like this hair right here in this pocket, it's a lot shorter. So I didn't know like if PRP, like how the injections work, if they're just targeted areas, or like does it kind of spread around your whole head?
Yeah, so I tell people that the pool of the yield of your blood when we draw it and spin it is only going to be as good as the health of that patient. And so thankfully I feel like I didn't see any red flags in your intake form, and so you should be an ideal candidate. Essentially, you're young, you're healthy, you're otherwise fine. So I think you would be a good candidate for it and have a good pool overall. Whereas if I had like a 70-year-old smoker and history of X, Y, and Z, that might be a little bit a harder sell for them. It may not be as beneficial. So for example, like last week or so, we had done one, and I got, I think 5 syringes from that person, and then another time I had done another person's and only got 2 syringes worth. You see what I'm saying? And so thankfully it depends on the targeted area. Also, if I'm treating a whole scalp and I only have 2 syringes, that's going to be harder for me to stretch. Whereas that person, they had plenty to utilize. So I think that you would be okay as far as the yield that you would receive, but we inject that into that person's affected areas. So if you do not want any in the crown of the scalp, we wouldn't put any there. We would target more so the frontal scalp and then the sides that you're looking for. And each time, we could reassess to be able to say, okay, well, this time, that left side filled in really nicely, but on the right side, I felt like I could use a little bit more. So then we would adjust that. And we're constantly just adjusting things to be able to target to, what you're seeing. And that's why your feedback is so helpful. Being able to, you are looking at this more so every day. So being able to get your feedback of like, this time I feel like I want to target more on the right side, but just trying to cater to the areas that you're noticing as well as far as where you're thinning.
Okay, that sounds good. So then when you do like go in for like I guess kind of like a maintenance thing like every year or however often you need to, you still target the same areas.
Right. Or if there's a new onset, let's just say, at first we were only targeting the frontal scalp and then the sides, but then the second time you come in, you're like, my crown is starting to thin a little bit more, a little bit further back. Then we would, discuss that and be able. So it's completely, each appointment is a reassessment essentially,
Okay.
and we'll target what needs it essentially, and we don't have to put it in areas that we feel is not necessary for.
Okay. So like with that, because I'm looking like for more density in like I guess just the hair to grow because like I said like this area it's pretty short, so I'd be able to possibly achieve that with PRP.
Yeah, can stimulate new hair follicles and also improve the hair growth of existing hair follicles. So I don't think that you'll have any problem getting density. Really, that's what I tell people for the most part is what we're looking for. To revitalize your scalp, not necessarily get more length, but by having more density, you should be able to get length over time.
Right.
And so that area should fill up just fine. And then with guys, I always tell people, make sure to get your pictures in like you're doing right now, it seems, to be able to reassess, because sometimes because they're getting more frequent haircuts, they may feel like, oh, is it a little less this time? And whereas women, it's a little bit different. So like you're doing, continue with your photos, and each time we'll kind of reassess based on what we see.
Okay, that's good. So okay, it sounds like pretty like something I'd want to try. So at what point would you guys like kind of I guess come up with maybe a recommended plan for me, like maybe what you think I should do or like
we can definitely text at the end of your appointment all the things that we discussed and what our recommendations would be. Normally I'm having people do them about a month apart, so just keep that in mind based on your scheduling. We usually actually like for people to start the Nutrafol beforehand, so we do have a link that has a discounted price where you can get it cheaper than you would be able to on like Sephora or Amazon through us for the men's supplements, to start that actually before they come in to get started. That way, again, because it's addressing underlying issues such as nutrition, you're well hydrated, you can kind of prepare for getting the best yield so that you have the best results possible. So we usually will have people start that a little bit before their treatment sessions. But yeah, we could definitely kind of tailor specific things. If you ever in the future even decided, I do want another prescription option topically, and you're like, I kind of want to pull away from the prescription pill, we do have a compounded option as well for that with some of the stronger doses of minoxidil and finasteride, again, through a topical that is unavailable without a prescription. And so if that's something that you're ever interested in, just let us know.
So is that something where your scalp would still need to be dry, and like you apply it twice a day, or like how would that work? What you just mentioned.
Or have them just apply it once a day on the areas of when they're not going to be shampooing on dry hair. So I don't know how often are you washing right now, or is there a certain time of day where you do wash?
Like I'll wash like once a week right now,
Okay,
but like
perfect.
my hair is prone to like being really dry. So like when I do wake up in the morning and like style my
Hmm.
hair, I wet it. So
Hmm.
that's kind of like where my concern would come in with like applying something to my
Gotcha.
scalp. That's because I was doing that for a while with the minoxidil, and I was like, dang, like it's kind of like contradict. Like
Defeating the
it's
purpose.
yeah, like it's
Yeah.
like my scalp's wet, and then I have to do this twice a day, and then it's like it's supposed
Yeah,
to be
I
dry.
would pull off to just once a day then, especially since you're doing a stronger compounded therapy as opposed to the 5%, which is available over the counter. And then do it probably at nighttime. That gives you 8 hours plus or minus of therapy being able to penetrate your scalp before your scalp is wet again.
And then that would also take me off of like medication, technically, like
Right.
too.
So
So
if that's something that you eventually, you have to weigh your options on, do I want to do this versus that as far as the oral therapies. But if you ever say, I do want to pull off the oral compounded minoxidil, I do want to try the Nutrafol, but then maybe I do a topical with it. It's still a drug option, but not something I'm taking systemically. At least that's available to you.
okay, and then also, I don't necessarily have a problem with having to like keep up with something to like maintain my
Mhm.
hair. Like I'm fine with that. The Nutrafol though, like I know you mentioned it was 4 pills. Is that every day, like for the rest of your life?
Sadly.
Okay,
So people can spit them out. They are capsules, so slightly easier to swallow as opposed to like a tablet, so to speak.
right.
But yeah, can be spaced out. Nutrafol also again does have serums as well. Some people are not interested in even doing the oral therapy, so there are serums as well. They're water based, so they're not going to make your scalp any oilier or create any excess buildup. But basically, it's taking some of the exosomes that are within the Nutrafol brand and compounding those on a topical level, so that if you choose to not want to do the 4 tablets for whatever, or 4 capsules for whatever reason, you're able to get the benefits of the serum as well.
Okay, okay, that sounds good. And then you were saying, like each session, I mean, it's possible you were able to see results after each session, but it may, like, how long
Actually, yeah.
do you think? Okay,
I would recommend for you probably 3. But even after 1, I'm seeing something. So there hasn't really been, but maybe one person that I can think of is where we were like, I hadn't really seen anything. By the second session, they did see results. But for most people, I'm seeing even the difference even after a few weeks. We had a patient kind of question if she was getting results because she was having more hair fall. I don't know if you noticed, even when you were doing topical minoxidil, sometimes a dormant hair follicle will fall before the new hair follicle proceeds. So she was having some fallout, but based on our photos of 2 weeks, we could put side by side comparison. She did actually notice that she had fuller hair, but just was unable to really see that because she was kind of looking at it every day.
right.
But that's why we take and kind of emphasize our photos, because we're looking at minor changes. Sometimes people's hairstyle is kind of different as well.
Right.
But we're looking at minor changes, and so the photos really do make a difference.
Okay. I think now last question with the Nutrafol. How long do you recommend that someone's on it before they start PRP? Like,
I would say at least a month. I would say at least 30 days, just to kind of, I allow a little bit of time for people to forget too. So
right.
I feel like I had a lady, she's kind of like, I've been somewhat consistent. So I'm like,
Okay.
usually a couple of weeks at least, to get it in your system. And that way, again, you have the best yield possible prior to scheduling.
Okay. I think what I'll do then is like just probably a little more research on everything we discussed to kind of familiarize
For
myself
sure.
with it, and then I think what I'll do after that is see if the cherry option is best for me, then start
Hmm.
Nutrafol and like discuss with you guys when I could come in and stuff like that.
Perfect.
So I
And
think
don't
that's
forget, I'm
kind of what
going to
I'll look
text
for.
you all of this information. It'll have pricing, more information about Cherry, what we discussed, what my recommendation is, and also the other things that we offer here in our office.
Okay, sounds good. I really appreciate you taking out the time to speak to me though, and
Oh,
feel a
of
lot better
course.
after
It's been a
speaking to you.
pleasure.
So I appreciate it.
Yeah.
Thank you.
Of course, of course. If you think of anything, just give us a holler. The girls who are behind the actual message, they're real people. Some people think that it's like a telemarketer or a spam or something. I'm like, no,
Right.
we're real people. So if I know we're kind of information overloading you now, but even later, if you think of some questions after I've already sent you everything, just give us a holler.
Um.
So, yeah, write down any questions you may have. Think about everything. We'll try to our best to answer any questions you may have along the way. But if nothing else, you have a great weekend, and we look forward to seeing you soon.
Sounds good. Thank you so much. I appreciate it. All
Have a
right.
good
Have a good
weekend.
one. Nice meeting you.
Bye.
That was great. I feel so good. They seem like really. I feel like I found a good place, so that was good. She's African American, which I love. That makes me a lot more comfortable. She's very knowledgeable. It seems like. Uh, and then now I'm just glad that like I know my options like better. So yeah, I'm glad I know my options better now than I did before. It's so funny because I looked up Nutrafol and I didn't know. So that's something I would recommend. Like, I'm kind of already in the thick of it, but I think that's something that I would have tried to do after the hair transplant. Like, I probably would have tried to find somebody like this before I decided to get on minoxidil and finasteride. Because I really got on it because I was like, I feel like that's probably my only option right now, like one of my only options, so I don't know. But whatever, you live and you learn. So I can only move from this point moving forward. But I'm definitely gonna read on Nutrafol a bit more and see what the best options would be. I feel like I want to try PRP though because, like, why not? I think like I think for me to get the results I need, I'm probably just gonna have to do like a series of things, which I'm fine with because this is all like a learning process, and I'm just figuring out what'll work best for me and like how I can get the results I want. Cause I feel like the hair transplant helped me out a lot. I think that was kind of like the foundation of just like I don't know. I feel like I did go into it thinking that it would fix everything, and I feel like everybody's a bit different. So I feel like right now, if I am correct, for me, it feels like the hair transplant was just kind of the like laying the foundation for me to like resolve my difficulties and like wanting to get the type of results that I want and stuff like that. So I feel like PRP would enhance it and just kind of make help me achieve what I'm trying to get as far as my results. So, yeah, yeah. And she's saying that you could see results as early as the first session, but you may see them after like the second session or several sessions. So, that's cool. That's fine with me. I kind of just, I'm kind of like the type of person like I just kind of want to like plan things out, but then also be on top of it so that way, because I know these things take time. Like, I want to be able to do something, know that it's working in the background as time goes on, and then before I know it, like, I'm achieving my results and stuff like that. Like the hair transplant, I got it last year because I knew that a year from that moment, I wanted to like have significant hair growth. And I have. I'm just not like at 100% satisfaction with it. But I started the process. So, and it's been working for like 10, almost 11 months now. Like it's been working in the background. So, yeah, it's exciting. I think, like I said, I'm just going to do research on PRP and Nutrafol and then kind of decide if I want to. I think one of my main concerns is like getting off finasteride and minoxidil because I kind of want to. Like, like I said, I only took it because I thought it was like my only option really, but and it's always one of the first things that's recommended to you by doctors and you know, medical like people. But I'm glad that this place takes a holistic approach and kind of addresses it outside of medical therapy, which is what I've been trying to like find. But I've been trying to get that basically through someone who knows what they're talking about because I don't know about it. And I'm just trying to learn about it and go about it, you know, with someone who knows what they're talking about. So, yeah. Other than that, like, I feel like from month to, I'm about to be on month 11. I'm pretty close now. Month 10 to 11, I haven't really seen a big difference, to be honest. I saw like significant differences like in earlier months, but I feel like I haven't seen a huge change this time around, like from 10 to 11. Not that that's bad, but I just haven't really noticed much. So, yeah, like it's kind of, I don't know if you guys can tell, but like here, I don't know if the camera's gonna pick it up, but like right here, and then kind of here, like where my trouble areas were, especially here though, really, it's not even bothering me here. It's like really here, like right behind my hairline. This hair is shorter, so that's where I would do PRP for sure. The hair is shorter, and it's just it's way less dense, but it's significantly shorter. Like my hairline hair, when you look at me straight on, like from this angle, for the most part, it looks fine. Like it looks normal, but it's like right after it here, it's like it's just a lot thinner. So maybe that hair didn't like take as well. I don't know, but beats me. But honestly, I will say, before I started taking minoxidil, and then when I started taking minoxidil, like this same trouble area, I was having down the middle of my head, like to my crown. So like the whole shortness of hair, whatever, it looked like that, like all the way here before I started taking minoxidil. Once I started taking it, it grew, filled up. So, yeah, it grew like a lot. So, so I feel like, I say all that to say, I feel like it's possible that this is gonna do the same thing. Like it'll just grow in like the rest of this. I just feel like it's taking long. I am impatient, but I feel like it's just taking a long time. I feel like this area is taking a long time to catch up to like what this did, if that makes sense. So yeah. But the meeting went great. I feel very comfortable with them already. I I would definitely strongly consider doing this with them, and if I decide to, I'm gonna document it for sure. Oh my gosh, my nose itches so bad. Sorry. I'm gonna document it for sure. Ooh. I think my main thing though, after having that meeting with her, I think my main thing that I'm thinking about is like, would I want to take Nutrafol instead of minoxidil and finasteride? Or would I want to take that with minoxidil and finasteride? Because just say, for example, I stay on minoxidil and finasteride and then I also do Nutrafol. That's taking 5 pills a day. Like, that's, I mean, not that that's impossible or that's a bad thing. Like, you got to do what you got to do. I have no problem sticking to something or being consistent with something if it's going to maintain my results. it's just like brushing your teeth or going to the gym or washing your face or like taking a shower. Like you have to do all these things to consistently maintain cleanliness, clear skin, results in the gym. You know, you got to eat every day so you stay alive. Like it, like all these things. That's how I think about it. So I don't mind doing something to maintain results. It's just like, damn, like that's a lot of like in my mind. Like, I mean, but some people take like hella vitamins a day. So I guess I think it just depends how you think about it, like your mindset and stuff. So that's like one thing that's like one way to approach it. But if I'm being honest, I think I would rather not take medication like drugs. I think I would rather not take drugs to maintain results and take a holistic approach if I could. I'm trying to figure out what is going to be the best option for me. Like, for example, I'd rather take Nutrafol with the 4 pills a day, knowing that it's not a drug, than take 1 pill a day, finasteride, phenoxidil finasteride, and knowing like it's a drug, if that makes sense. Like I want to be as natural as possible, which is why I waited so long to even start minoxidil and finasteride, because I wanted to see how the transplant would do. Had I known that Nutrafol wasn't necessarily a drug, or like if I knew more about it, I might have tried that first. But at this point, like I'm already taking the pills, so it's whatever. Yeah. So that's what I got to think about. That's what I'm gonna think about. How I want to like approach this. And she mentioned that they would kind of like assist me in my options and maybe what I should do or what I can do. So I'll definitely take what they have into consideration. But before I even take Nutrafol, like I want to think, what do I want to do? What do I think is going to be the best for me? And like just do research on everything to see what I guess I'm comfortable with and what usually breeds the best results. So that's what I'm going to think about. If I do decide to do the PRP, I would definitely document it. And I feel like I am going to do it. It's just a matter of when. I don't know. I feel like I would do it though. Honestly, I feel like I would do it. Because like I want certain results. So I feel like I would do it. I want it to be more dense in this area and stuff. So I feel like I feel like if I were to get the shots, I would get them in these corners because it's so hard to tell like what y'all can see. I feel like one of the sides is not as well, but like, I mean, the hair is growing, but it's like, where is it? I feel like because I'm on camera, I can't see it as well. There's like one of these corners where it's just not, maybe you could tell already, I don't know. I don't know, bro, but when I look in the mirror and I like move the hair around and I like see, I could tell like there's not as much hair. Anyway, I would do it like in these corners and then this area, of course, and then like just basically down here. Dang, that's what I meant to ask her. And I would do it like in my crown. That's what I meant to ask her. She mentioned syringes and how many syringes she could get from a person. Like she mentioned one person, she might have got 2 syringes from them, and she has to distribute that around their head. And that may be more difficult if they have more hair loss around a lot of their head versus someone who maybe has 5 syringes. It'll be a bit easier to kind of spread that around. I meant to ask like, how does that work? How do you get a certain like, just to her to explain that. So I'll probably message them and ask them to explain that if they could, because that's one thing I did forget to ask. But yeah, it's almost 11 months, and I honestly need to do like an 11th month update. I would say like so far, for the most part with the hair transplant and everything I've done up to this point, I am happy with my results. I'm just not 100% satisfied. I think right now I'm like, out of 100, I would say I'm like 80% satisfied 11 months in. I would say I'm like 80% satisfied with my hair growth and results over the past almost 11 months, which is not bad. I'd rather be where I am now than where I was a year ago. So I'm very grateful, and I feel like I've made a lot of progress. I just want to get the best results possible is all that I'm looking for. I want to do the best that I can with it. I want to get the best possible results because I'm growing my hair out. I want to continue to grow it out. I've never had a problem like with my hair texture. I love it. I just want it to grow. Like, that's all. I just want it to grow. I just want it to grow and grow even and, you know, be happy with it and, like, yeah, love on it. So, I will say, like, with this process, I'm learning a lot. Like, I'm just learning a lot. I'm taking so much information and overall. So, that's cool. But overall, the meeting went well. The meeting went well. I feel like these are probably my people that I'm going to go through it with. They're very trustworthy. Like, the whole dialogue was just great. I felt very comfortable with them and that I could trust them. So I will definitely record and update and, like, just, you know, everything, go through it. So yeah. All right. But I think I recorded enough. So I'm going to get on. All right. Until next time.